Acute sinusitis, acute rhinosinusitis, causes the cavities around your nasal passages, sinuses, to become inflamed and swollen. This interferes with drainage and causes mucus to build up. Please share your thoughts, like and subscribe. Thank you. With acute sinusitis, it may be difficult to breathe through your nose. The area around your eyes and face may feel swollen, and you may have throbbing facial pain or a headache. Acute sinusitis is most often caused by the common cold. Other triggers include allergies, bacterial and fungal infections. Treatment of acute sinusitis depends on the cause. In most cases, home remedies are all that's needed. However, persistent sinusitis can lead to serious infections and other complications. Sinusitis that lasts more than 8 weeks or keeps coming back is called chronic sinusitis. Symptoms: acute sinusitis symptoms often include drainage of a thick, yellow or greenish discharge from the nose or down the back of the throat, nasal obstruction or congestion, causing difficulty breathing through your nose, pain, tenderness, swelling and pressure around your eyes, cheeks, nose or forehead, reduced sense of smell and taste, cough, which may be worse at night. Other signs and symptoms can include ear pain, headache, aching in your upper jaw and teeth, bad breath, halitosis, fatigue, fever. When to see a doctor: if you have mild symptoms of sinusitis, try self-care. Contact your doctor if you have any of the following symptoms that don't improve within a few days or symptoms that get worse: a persistent fever, a history of recurrent or chronic sinusitis. See a doctor immediately if you have signs or symptoms that may indicate a serious infection. Pain or swelling around your eyes, swollen forehead, severe headache, confusion, double vision or other vision changes, stiff neck, shortness of breath. Causes: when you have sinusitis, the mucous membranes of your nose, sinuses and throat, upper respiratory tract become inflamed. Swelling obstructs the sinus openings and prevents mucus from draining normally, causing facial pain and other sinusitis symptoms. Blocked sinuses create a moist environment that makes it easier for infection to take hold. Sinuses that become infected and can't drain become pus-filled, leading to signs and symptoms such as thick, yellow or greenish discharge and other symptoms of infection. Acute sinusitis can be caused by viral infection. Most cases of acute sinusitis are caused by the common cold. Bacterial infection. When an upper respiratory tract infection persists longer than 7 to 10 days, it's more likely to be caused by a bacterial infection than by a viral infection. Fungal infection. You're at increased risk of a fungal infection if you have sinus abnormalities or a weakened immune system. Some health conditions can increase your risk of getting a sinus infection that causes sinusitis, or can increase your risk of getting sinusitis that isn't caused by an underlying infection. These conditions include allergies such as hay fever. Inflammation that occurs with allergies may block your sinuses. Nasal polyps or tumors. These tissue growths may block the nasal passages or sinuses. Deviated nasal septum. A crooked septum, the wall between the nostrils, may restrict or block sinus passages. Tooth infection. A small number of cases of acute sinusitis are caused by an infected tooth. Other medical conditions. The complications of cystic fibrosis, gastroesophageal reflux disease (GERD), or immune system disorders may result in blocked sinuses or an increased risk of infection. Risk factors: you may be at increased risk of getting sinusitis if you have hay fever or another allergic condition that affects your sinuses, a nasal passage abnormality, such as a deviated nasal septum, nasal polyps or tumors, a medical condition such as cystic fibrosis, GERD, or an immune system disorder such as immunoglobulin or antibody deficiency, regular exposure to pollutants such as cigarette smoke. Complications: acute sinusitis complications include asthma flare-ups. Acute sinusitis can trigger an asthma attack. Treatments and drugs: most cases of acute sinusitis don't need treatment because they're caused by viruses that also cause the common cold. Self-care techniques are usually the only treatment needed to speed recovery and ease symptoms. Treatments to relieve symptoms: your doctor may recommend treatments to help relieve sinusitis symptoms, including saline nasal spray, which you spray into your nose several times a day to rinse your nasal passages. Nasal corticosteroids. These nasal sprays help prevent and treat inflammation. Examples include fluticasone, Flonase, mometasone, Nasonex, budesonide, Rhinocort aqua, triamcinolone, Nasacort AQ, and beclomethasone, Beconase AQ. Decongestants. These medications are available in over-the-counter (OTC) and prescription liquids, tablets and nasal sprays. OTC oral decongestants include Sudafed, Active and Drixoral. Nasal sprays include oxymetazoline, Afrin, others. These medications are generally taken for only a few days at most. Otherwise they can cause the return of more severe congestion, rebound congestion. Over-the-counter pain relievers, such as aspirin, acetaminophen, Tylenol, others, or ibuprofen, Advil, Motrin IB, others. Aspirin has been linked with Reye's syndrome, so use caution when giving aspirin to children or teenagers. Though aspirin is approved for use in children older than age 2, children and teenagers recovering from chickenpox or flu-like symptoms should never take aspirin. Talk to your doctor if you have concerns. Antibiotics usually aren't needed to treat acute sinusitis. Antibiotics won't help when acute sinusitis is caused by a viral or fungal infection. Most cases of bacterial sinusitis improve without antibiotics. Antibiotic treatment is generally needed only if the infection is severe, recurrent or persistent. Antibiotics used to treat acute sinusitis caused by a bacterial infection include amoxicillin, Amoxil, others, doxycycline, Dorix, Monodox, others, or the combination drug trimethoprim sulfamethoxazole, Bactrim, Septra, others. If the infection doesn't go away or if the sinusitis comes back, your doctor may try a different antibiotic. If your doctor does prescribe antibiotics, it's critical to take the entire course of medication. Generally, this means you'll need to take them for 10 to 14 days, even after your symptoms get better. If you stop taking them early, your symptoms may come back. Antifungal medications rarely. Acute sinusitis is caused by a fungal infection, which can be treated with antifungal medication. The dose of medication, as well as how long you'll need to take it, depends on the severity of your infection and how quickly your symptoms improve. If allergies are contributing to your sinusitis, allergy shots, immunotherapy, that help reduce the body's reaction to specific allergens may help treat your symptoms.